naweza waambia mtoto akiwa hivyo sio mwisho yake, na asistuke tena, ajikubali na akubali vile hali ilivyo, then anaweza chukua hatua na akuje huku Kenyatta na mambo ya mtoto wake itakuwa sawa kwa kila jambo. Kwa sababu wangu nimeona saa ni mara ya mwisho niwe nikisema ako sawa. Kwa hivyo mtu asifiche mtoto na mtu asiogope mtoto vile alivyo. Akuje na mtoto atapata matibabu hapa.
What happens is during birth, in babies who are either too big or have if the birth process is a difficult labor, during the process of removing the baby, the nerves that supply the hand tend to be stretched, and the nerves that supply the hand are the ones that are called the brachial plexus. So this process of stretching the nerves causes an injury to them, and it causes a sort of paralysis to the hand. So the baby is born not being able to move the upper limb, the affected upper limb. And that is what we refer to as the brachial plexus birth injury.
Yes, this is the first time we are performing this, and we are very happy, we are excited because this is another landmark surgery that we are doing as a Plastic and Reconstructive Surgery unit. In fact, the first thing, if a mother realizes the child is not able to move his or her hand well, because even small children will be able to move their hands, then the first thing is they should really take this child for examination by the medical team. And if for whatever reason we suspect that there's a brachial plexus injury, then refer them to Kenyatta National Hospital, where we can be able to evaluate them in the plastic surgery department and be able to institute management early. In fact, our biggest problem is late presentation of this patient. The earlier, the better.
So for any person, any woman who notices the child's upper limb is not working immediately after birth, the most important thing is to seek care from the specialized professional. So in which case it would be, we have to refer you to an occupational therapist immediately, and you also have to start follow-up with a plastic surgeon or someone who does the surgeries. In our case, it's a plastic and hand surgeon, so that we can determine we can properly diagnose you and then also determine the best time for the surgery and do the surgery as early as possible, so that we can mitigate a lot of the complications that happen.